What's up, YouTube? My name is Dr. Jason Mango, and welcome to my channel. I'm a board-certified and licensed doctor of physical therapy in Boston, Massachusetts. Today, I'm going to uncover the truths about my profession. So, if you like my content, please feel free to like, comment, and subscribe, as I'll be uploading a new video every week. Before we get into the secrets of physical therapy, we need to define what PT really is. Physical therapy is dedicated to promoting, maintaining, or restoring function through exercise or manual therapy. And this goes for a variety of patient populations ranging from neurological conditions, cardiovascular, pulmonary, or orthopedic conditions. And that sounds great and all, but does it work for everyone? And unfortunately, the answer to that is it depends. And this is the first truth that we're about to uncover. Now, a majority of people will have some level of benefit with physical therapy, but there's no way to determine whether that's 30% improvement, 60% improvement, or complete resolution of your symptoms. Although, a majority of people will have some benefit with PT. And regardless of whether you have an improvement in your symptoms, there's other added benefits of physical therapy, such as daily exercise and promoting a healthy lifestyle, as well as boosting your overall mood. And on the evaluation with your PT, if they happen to be doing a systems review for you, which every physical therapist should do, they may find other problems and catch them early on so that they can refer you to the proper specialist. Now, for the next hidden truth, what I want to talk about is answering the question of, is physical therapy right for everyone? Some patients will come into the clinic with extreme levels of pain, up until the point where they can't even tolerate the most basic fundamental exercises. And unfortunately, in situations like that, it's really difficult to get through, let alone the evaluation, but any exercises and treatment past that. Now, in situations like this, what we'll often do is we will work together with someone who specializes in pain management, such as like a spine doctor. They will end up prescribing medications or giving a cortisone injection that will help them tolerate some level of exercise to give us the best chance that we can have at making the patient feel better. Now, in some situations when the pain is just so severe that they still can't tolerate land-based physical therapy, even when the pain management doc is coming on board, what we would opt to do is regress physical therapy to aquatic PT, which is where we'll do water-based exercises so that the buoyancy in the water is going to reduce the amount of load on your joints and allow the patient to be moving and exercising in the water. And this is so important for patients that have very severe chronic pain. Now, before I uncover the next hidden truth, what I want to do is set the scene for you. This is a very common scenario I see in the hospital every single day. So a patient comes in to see me. They have neck and upper back pain, and they work at a desk 8 hours a day, 5 days a week for years and years and years. There was no initial injury, and their pain just gradually came on. So they come in to see me for physical therapy, and 2, 3 weeks in, we start seeing some good improvements. Maybe around 4 and 5 weeks is when things are going awesome. They're doing their exercises consistently, they're feeling great, and they had resolution of their symptoms. They're ready to discharge from PT. And this is the point in time where a lot of people make a huge mistake. Physical therapy is not something that you just do for a short period of time and then it stays away forever, most likely. Because if you return back to doing that original activity that you were doing that caused your pain, the pain is going to come back. It is so important to be doing your exercises in the long term. And that is one of the secrets of PT that not enough people know about. So the general rule that I'm going to teach you is after you discharge from physical therapy, you need to continue to do your exercises at least 2 or 3 days a week in the long term to maintain your progress and minimize the risk of those symptoms coming back. Now, my personal goals as a physical therapist is not to make my patients better in the short term. It's to make them not dependent on me, provide them with the tools that they need in order to manage their symptoms independently in the long term. All right? If not, I just created an infinite money loop, which is kind of cool, but I don't want to see my patients that frequently. I don't want to see them 6 months out for the same thing that I saw them for originally. I want them to come back and be thinking, wow, I was doing so good with my neck pain. Now that my ankle hurts from this ankle sprain that I had another time, I want to see Jason. So those are definitely the most important secrets that I wanted to share with you guys. So I really appreciate you guys watching to the end of this video. If you have any questions, please feel free to comment. Also, feel free to like and subscribe to the channel, and I will see you next week. Thank you.